In the last video on decalcified bone tissue, I forgot to comment on decalcification. If this is a paraffin section, it was done on a microtome and cut maybe 5, 10, 15 microns in thickness, but without removing the mineral, the calcium hydroxyapatite, you would not be able to section this bone. You'd have to prepare a ground section, which would not be stained and it would be white. I don't think we have an example of that. However, you do have in WebMic an example of ground section of bone, which will show the cannuliculi and things like that that allow communication between the osteocytes that you see here. But the eosinophilic staining you see is all due to the collagen fibers, and if the mineral is still here, you would have basophilia in here, but all the mineral has been removed. Okay, so I'll just go out of that and take the next specimen, which is developing bone. And the purpose of this specimen is to give you a chance to study endochondral ossification. Bone can grow by appositional growth, by the deposition of bone on the periphery with the periosteum. They can also grow in length by the action of the cartilage cells dividing in the epiphyseal plate. Now, when you look at this specimen, this is a joint. This little slit right here, it's between the ends of two bones, and this is the epiphysis of one bone, and this is the epiphysis of the other. The epiphysis is composed completely of hyaline cartilage with very, very fine collagen fibers, ground substance. And as you see here, the cartilage cells are beginning to divide at this point, and they're all lined up in a row. And that is what is adding the length to this long bone. And once and this is all being pushed in this direction. It's getting longer in this direction to the left. And so as these cells divide, then finally they begin to enlarge the zone of hypertrophy. And then you get the area where the cartilage is calcified. And in that region, in the calcified cartilage, you get bone deposited upon the cartilage template. And these are osteoblasts that are going to produce bone. And finally, out here, you see the result of the osteoblasts depositing bone on the cartilage that is partially calcified. So when you study this specimen, try to keep all that in mind. And here you have bone spicules, but all this bone arose as a result of a cartilage template, and that is endochondral ossification. Endo within a cartilage template or model. So this is a bone spicule. And there are examples of osteoblasts all along here. All these basophilic cells are osteoblasts. And out here is the fibrous perichondrium, periosteum. And here's a small arteriole and a venous vessel out here. Okay, so but you're not studying those now. Here's some more bone that's being formed out here. Look at all the osteoblasts that are lining here and depositing bone. So you have different terms to learn: osteoid, osteocytes, osteoblasts, osteoclasts, etc. And out here, this is skeletal muscle that is attaching to the bone, and this is in a developing fetus, so the skeletal muscle is somewhat immature. Okay, I think that's all we need to elaborate on this specimen.